If you take a blood pressure pill every morning, whether it's amlodipine, losartan, or lisinopril, let me ask you something important. Do you actually know what that medication is doing inside your body right now? Not just the name on the bottle, not the quick explanation the pharmacist gave you when you picked it up. I mean, truly understand it. Do you know how it lowers your blood pressure? Do you know what warning signs to watch for? Do you know which symptoms are harmless annoyances and which ones could signal a serious problem that needs attention immediately? Most people don't. And that's not because they're careless. It's because nobody ever takes the time to explain these medications properly. Millions of adults swallow the same tablet every day without really knowing how it works, what it interacts with, or what changes in their body might be connected to it. They assume that because they've been taking it for months or years, everything must be fine. But these medications are powerful. They don't simply lower a number on a blood pressure monitor. They affect blood vessels, kidneys, fluid balance, circulation, and even the way certain chemicals move through the body. Understanding them can make the difference between feeling confident and feeling confused when something unexpected happens. Let me tell you about a man named Raymond. Raymond was 76 years old, retired, organized, and extremely responsible when it came to his health. He never missed appointments. He took every medication exactly as prescribed. When his doctor added amlodipine to help control his blood pressure, Raymond didn't think much about it. To him, it was just another blood pressure pill. A few months later, something strange started happening. His shoes felt tighter. By the end of the day, his socks left deep marks around his ankles. His legs felt heavy and uncomfortable whenever he walked. At first, he ignored it. Then he started worrying. Eventually, he became convinced something was seriously wrong with his heart. He stopped taking long walks. He became less active. He spent late nights searching online for symptoms of heart failure. The truth was far less frightening. His swelling was a known side effect of amlodipine. The medication was working exactly the way it was designed to work. The problem wasn't the drug. The problem was that nobody had explained what to expect. You see, amlodipine, losartan, and lisinopril all lower blood pressure, but that's where the similarity ends. They belong to different families of medications, they work through different mechanisms, and they create different side effects. Amlodipine relaxes blood vessels by affecting calcium movement within the vessel walls. Lisinopril blocks an enzyme that normally causes blood vessels to tighten. Losartan blocks receptors involved in the same blood pressure system, but through a different pathway. 3 medications, 3 mechanisms, 3 completely different patterns of side effects. When people understand those differences, they stop assuming every symptom means the same thing, and that's exactly where we need to begin. Now let's stay with Raymond's story for a moment because it explains one of the most common misunderstandings about amlodipine. When Raymond's ankles started swelling, his first thought was heart failure. His second thought was poor circulation. His third thought was that he was simply getting older. But the real explanation was different. Amlodipine relaxes the small arteries in your legs so blood can flow through them more easily. That is part of how it lowers blood pressure. But the veins, the vessels that carry blood back toward the heart, do not always relax in the same balanced way. So more fluid pressure builds in the lower legs, especially around the ankles. By afternoon or evening, you may notice puffiness, tight shoes, heavy legs, or deep sock marks that stay visible for hours. For many people, this swelling is not dangerous by itself, but it should never be ignored or silently tolerated. The danger often comes from what people do next. Some people stop taking the medication on their own. Others drink less water because they think the swelling means they have too much fluid in the body. Some simply live with it for months until they stop walking as much, become less active, and lose confidence in their own body. None of those choices is ideal. The right response is to tell your doctor, not with panic, but with clarity. Say, "Since starting this medicine, my ankles are swelling by the evening." That one sentence can open the door to solutions. Your doctor may adjust the dose, change the timing, combine it differently, or switch to another medication, but your doctor cannot fix a side effect they do not know you are having. And this is one of the biggest lessons I want you to take from this video. Side effects are not something you are supposed to hide. They are information. They help your doctor understand whether the medication truly fits your body. Now let's talk about lisinopril because this medication has a side effect that has confused thousands of people. It is the dry cough, not a chesty cough, not a cough with mucus, not a cough that feels like infection. It is often a dry, irritating tickle in the throat that keeps coming back. It may be worse at night, it may disturb sleep, it may make you clear your throat again and again. The frustrating part is that it may not start immediately. Some people develop it within days, but others notice it weeks or even months later. By then, they no longer connect the cough with the medication. They blame allergies, they blame dust, they blame weather, they blame reflux, they buy cough drops, syrups, antihistamines, and air purifiers, but the cough stays. Let me tell you about Margaret. She was 69 and loved gardening. When she developed a dry cough in spring, she naturally assumed it was pollen. The timing seemed perfect. She tried allergy medicine, she cleaned her bedroom, she changed her pillows. She even had a chest x-ray which came back normal, but the cough kept waking her at night. Month after month, she became more tired and more worried. When someone finally asked her when she had started Lisinopril, the answer changed everything. She had started the medication several months before the cough appeared. When her doctor changed her to a different blood pressure medicine, the cough settled within a short time. Months of frustration ended because someone finally connected the dots. This does not mean everyone on Lisinopril will cough. Many people take it very well, but if you are taking it and you develop a persistent dry cough that does not respond to normal remedies, do not ignore the possibility. Ask your doctor whether the medication could be contributing. And here is something even more important. There is one reaction connected with ACE inhibitors like Lisinopril that is not just annoying, it is urgent. If your lips, tongue, face, or throat begin to swell, or if breathing or swallowing becomes difficult, that is not a normal side effect to watch at home. That can be angioedema, and it needs emergency medical attention. A dry cough is a conversation. Throat or tongue swelling is an emergency. Keep that difference very clear. Now let's move to Losartan because this one is often viewed as gentler, and for many people it is. Losartan belongs to a class called ARBs. It can be a very useful blood pressure medication, especially for people who cannot tolerate the cough from Lisinopril. But gentler does not mean risk-free. One important thing Losartan can affect is potassium. Potassium is a mineral your body needs for muscles, nerves, and heart rhythm. But too much potassium can become dangerous, especially for the heart. The tricky part is that many people accidentally increase potassium without realizing it. They switch from regular salt to a heart-healthy salt substitute. They drink electrolyte powders, they use meal replacement shakes, they take supplements, they eat high potassium foods in large amounts because they believe they are doing something healthy. But some salt substitutes use potassium chloride instead of sodium chloride. So a person taking Losartan may already have a medication that can raise potassium, and then they add a potassium-based salt substitute every day at breakfast, lunch, and dinner. That combination can become risky. High potassium does not always announce itself clearly. Some people feel weak, some feel unusually tired, some notice muscle cramps, tingling, or an irregular heartbeat. Others feel almost nothing until the level becomes serious. That is why blood tests and medication reviews matter. If you take Losartan or Lisinopril, do not assume every heart-healthy product is automatically safe for you. Ask your doctor or pharmacist before using salt substitutes or potassium supplements. This is not about fear. It is about knowing which healthy habits fit your specific medication. Now, there is another situation that many patients are never warned about, and it becomes especially important as we get older. What happens when you get sick? I am not talking about a major hospital illness. I mean something ordinary, a stomach bug, vomiting, diarrhea, several days of poor appetite, a hot day with heavy sweating and not enough fluids. When your body becomes dehydrated, the same blood pressure medication that normally works well may suddenly behave differently. Your blood pressure may drop too low, your kidneys may become stressed, you may feel dizzy, weak, faint, or unusually tired. This does not mean the medicine suddenly became bad. It means your body's condition changed. Medicines work inside an environment, and dehydration changes that environment. This is why every older adult taking blood pressure medication should ask their doctor a simple question before illness happens. What should I do with my blood pressure medicine if I cannot keep food or fluids down? Do not wait until you are already sick and confused. Have a sick day plan written down. Know when to call. Know which symptoms matter. Know whether any medication needs to be temporarily held under medical guidance. That kind of planning can prevent real harm. And while we're talking about situations that catch people off guard, let's discuss something that seems completely harmless at first. Imagine you've had a long day, your knees ache, your back is bothering you. Maybe you've spent time gardening, walking, or simply moving around more than usual. You stop by the pharmacy and pick up ibuprofen or naproxen. After all, they're available without a prescription. Millions of people use them every day. What could possibly go wrong? The answer is that your kidneys don't care whether a medication came from a prescription bottle or a store shelf. They only respond to the chemicals entering your body. When medications like Lisinopril or Losartan are combined with anti-inflammatory pain relievers on a regular basis, the kidneys can be placed under additional strain. Add dehydration into the mix, and the risk increases even further. This doesn't mean you can never use these medications together. It means you shouldn't assume they're automatically safe for long-term use without discussing them with your healthcare provider. I've met countless older adults who were extremely careful with their prescription medications, but never mentioned the pain relievers they use several times a week. They didn't think it mattered. In reality, that missing piece of information was sometimes one of the most important parts of the entire medication picture. The same principle applies to supplements. Just because something is sold in a health food store doesn't automatically make it harmless. Certain herbal products, electrolyte mixes, recovery drinks, and over-the-counter supplements can affect blood pressure, kidney function, or potassium levels. Always remember that natural and risk-free are not the same thing. Now let's talk about one of the most underestimated symptoms in older adults taking blood pressure medication: dizziness. Not dramatic dizziness, not spinning room dizziness. I'm talking about that brief moment when you stand up and feel slightly unsteady. The moment where you instinctively reach for a chair, a wall, or the edge of a table. The moment that lasts only a few seconds and then disappears. Most people ignore it. They tell themselves they stood up too quickly. They tell themselves it's normal. They tell themselves it's just part of getting older. But here's why it deserves attention. As we age, our balance becomes more precious. A small stumble that would have meant nothing at age 30 can have very different consequences at age 70 or 80. A single fall can lead to fractures. A fracture can lead to surgery. Surgery can lead to weeks or months of reduced mobility. And reduced mobility can affect nearly every aspect of health. That's why even minor dizziness matters. Blood pressure medications lower pressure inside your blood vessels. That's their job. But when you move from lying down to standing up, your body needs a few moments to adjust. Sometimes that adjustment happens more slowly, especially in older adults or during periods of dehydration. The result is a temporary drop in blood flow to the brain. You feel it as lightheadedness. The good news is that simple habits can often help. Take your time when getting out of bed. Sit at the edge of the mattress for a few moments. Stand up slowly. Hold on to something stable if needed. Give your body a chance to catch up. These small actions may seem insignificant, but they can prevent serious accidents. And if the dizziness becomes frequent, severe, or is accompanied by fainting, that's not something to quietly tolerate. That's information your doctor needs to hear. Now let's address another source of anxiety for many people: home blood pressure readings. A lot of people become trapped in what I call the single number panic cycle. They take their blood pressure once. The reading is higher than expected. They immediately become worried. Then they check it again and again and again. With every reading, their anxiety increases, which can actually push the numbers higher. The truth is that blood pressure naturally changes throughout the day. It responds to stress, it responds to sleep, it responds to pain, it responds to activity, it responds to caffeine. It even responds to whether you're worried about the reading itself. One isolated number rarely tells the whole story. What matters is the pattern. A consistent pattern measured under similar conditions provides useful information. A random collection of readings taken throughout the day often creates more confusion than clarity. Try to measure your blood pressure at the same time each day. Use the same arm. Sit quietly for several minutes beforehand. Keep your feet flat on the floor. Avoid talking during the measurement. Then write the result down. Over time, those readings create a picture that is far more valuable than any single number ever could be. And perhaps most importantly, don't make medication decisions based on one unusual reading. Don't take extra medication because one number looks high. Don't skip medication because one number looks low. Blood pressure treatment is built on consistency, not reactions. These medications work best when they maintain a steady presence in your body day after day. That brings us to another common mistake: missed doses. Everyone forgets occasionally. Life happens. The question isn't whether you'll ever miss a dose. The question is what you'll do when it happens. Many people immediately panic and take 2 doses at once. Others skip several days because they're unsure what to do. Neither approach is ideal. The safest strategy is to have a plan before the situation occurs. Ask your doctor exactly what they want you to do if you miss a dose. Write the answer down. Save it in your phone. Put it next to your medication organizer. because when you realize you've forgotten a pill, that's not the best time to start guessing. The less guesswork involved in your treatment, the safer you'll be. And that's really what all of this comes down to. Not fear, not memorizing endless side effects, not becoming obsessed with every sensation. It's about understanding enough to recognize what deserves attention and what doesn't. Knowledge doesn't make medications more dangerous. Knowledge makes them safer. The people who do best on blood pressure medications aren't necessarily the people with perfect blood pressure readings. They're the people who understand their treatment, communicate openly with their healthcare team, and pay attention to what their body is telling them. Because at the end of the day, medication is not something that happens to you. It's something you participate in. And the more informed you are, the better that partnership becomes.